Now, we're also moving on to a different topic about the health of adolescents in this period. Now, report has it that more than 3,000 adolescents die every day, totaling 1.2 million deaths a year from largely preventable or treatable diseases. Our guest is supposed to analyze why young people need to take their health issues seriously and the effects of how they can, if they don't, how it will happen to them later in life. Now, joining us hopefully very soon is a medical practitioner and a youth counselor, Gloria Chibuike. We're having issues getting her connected. Hopefully very soon we can have her. But in the meantime, let's talk about our new,
yes, sir.
Which one? Africa Development Bank?
Our own.
It's not new now.
He's been re-elected,
but you know, it's the re-elected one. You are the son of the soil. You the kind of child.
Son of the soil.
The child you used to flaunt. the kind of picking will take the show. That kind of picking, because you know he's really represented us well. I felt very elated by this re-election especially because it was being investigated. By some foreign somebody to our continent, insisting that, you know, he couldn't have been
clean.
Just because I felt...
You don't know that.
No, I just felt just because he was Nigerian or just because he was African. Because the African Development Bank was for us, was created for us to develop Africa. And if your investments were clearly done in Africa, I don't see why another person is the one complaining. Africans were not complaining. We've really revamped our agricultural sector because of this bank, largely because of it. But mostly Nigerians now, if you go back home, everybody in my village is farming rice. They are carrying paddies, you know. People are doing
selling it.
Selling. People have businesses and, you know, options to do. Unlike before, everybody's carrying CV everywhere, begging you to come and get job for them. Most of the person milling my rice is a full graduate. Guy went to school, full graduate, and went back somewhere in the north to go and set up a mills where he mill rice. So because of these options, people have been empowered.
I'm even happy that, you see, it's always difficult sometimes to pick out those role models that Nigeria is proud of. Yes, we have lots of them out there, but not many of them are celebrated globally like this. So we have someone like this where, as you rightly said, he was probed, and this probe almost embarrassed him, but he stood his ground. That investigate. Nothing, you're not going to find anything on me. And exactly as we thought. And I'm happy that our president, other presidents within Africa, stood by him. Many world leaders stood by him, saying, we know this young man. And I'm so happy that they didn't find any, they exonerated him, and now he's been sworn in.
So that panel, there was a pro panel, 2 pro panels.
Headed by
Japanese, absorbed him, they say, no, you no do them. They put another one, and that one further absorbed him.
Okay, I'm told we have Gloria. You want to say something concerning
Yes, I say my former boss used to say that the reward for a job well done is more job. So you have done a good job, you have more to do. Please keep doing well.
Okay, I think we have Gloria now. Gloria, are you there?
Yes, I am. Good morning.
Yes, good to have you. Yay! I'm trying to connect with you. So, you see, I'm guilty of this conversation because when I read your work, you're saying that before 40 or by 40, we need to get health checks, make sure that we're okay. And honestly, I have been using mouth to go and get checked. I haven't gotten checked. So why do you think people, especially in my generation, find it difficult to take that step of ensuring they are healthy?
I just think the problem is, when it comes to Nigeria, one of the problems we have is, you know, self-doubt, and always not, like, most of us are not willing to learn. Don't get me wrong, only people who are like really exposed, you know, people who try to educate themselves, you know, whether they travel out or not. But most people who, you know, are not really connected to the world that much have a problem with believing that, oh, if I'm going, why do I have to go to the hospital if I have to go, and if I can go take this herbal medication, or if I can just go get malaria medication and I'll be fine. You know, it's a problem. They always feel like I'm fine if I can just take what I can lay my hands on. Sometimes I think is as a result of they don't want to spend their money, because when you bring it for free, sometimes you see that energy, you know, you see that, oh, okay, I'm going to do this now because it's for free.
Okay.
Excuse me, if there is no money to spend, because the problem is, if you go and do tests of something now,
and you come out positive with the test,
money
which
that
money are you going to use to treat yourself? That is the main problem.
Of a young person.
Not that I don't believe that, because I have realized there is no time you go to a hospital for checkup. They must find something. They will look and look until they find something. And then you will be in economic stress. Physical and mental stress and economic stress. Please answer me that question.
Okay, so the truth is, yes, a lot of people do not, have the funding to provide good health care for themselves. And that is one of the things that my organization is tackling. That's one of the things we're trying to provide in our own way, and also trying to, bring in the government and helping with that. But, I just think most times people don't make effort, because I feel like in every state right now, there are organizations trying to help people. You understand? People just need to learn how to connect, and also is to urge the government to be able to provide, free healthcare access, especially for the less privileged, for people who they know that they don't have, good funding in order to access these things. Because you're very right, you're very correct. This is one of the biggest problems we're having right now. A lot of people, they don't have money, and they feel like, why am I going to spend the little one I have to get that medical help?
So let's talk about the things. Let's give real examples of why people should worry before 40. So maybe in your experience, you've met people younger than who have ailments that are supposed to be for people above 40 in my case bracket. But that should start worrying. But let's talk about real examples, because people, it helps people relate easily.
Mm-hmm. Did you get that?
I didn't get the last thing you said.
Okay, so I was saying that we should talk with real examples. Maybe in your experience as a practitioner, you've seen people below 40 have ailments that are, for elderly people, things that you should get people to start to worry, or why they should check. For example, I would check every 2 years for my cervical, I do my pap smear every 2 years.
Okay.
So let's give real examples of, people who are below 40 and have ailments like that.
Like few months, I think last month, my organization partnered with an organization to run a program on hepatitis, where we had to give HPV vaccinations, and also run free testings for people. Now, there are a lot of young people that I have come across that have most sicknesses that they're supposed to have like after 40, or even way later, but it's as a result of them not being properly informed, them not being properly educated and exposed to understand that, for example, as a woman, like you said, you're supposed to know that from time to time, at least once a year, you're supposed to go for a cervical cancer test, and also, make inquiries on how you're supposed to get the vaccinations, and all that. So I have a lot of examples. I'm telling you the truth, because in this line of work, being a medical practitioner, and also, being leading a nonprofit organization, I get to see a lot of these things every time, especially when it comes to the nonprofit area, because I don't really practice here, but when I come down here and I go to these rural villages, you see young people telling you, oh, okay, I'm having this, I have, like diabetes and all that. I don't, rightfully, that's a sickness for someone who's like maybe older, but it's as a result of you not taking, proper care and not being properly informed.
Okay, all right,
so
Gloria.
I just think...
Right, thanks.
So there's this myth that with youth comes health, good health. So as a young person, you automatically have good health. And, some people also believe that, why do I want to stress myself when anything can kill a man? You know, I can take care of all my body. When it's time for me to die, it's time for me to die. Now, how do you get people to, you know, sort of change that mindset so that they can start paying attention to their health? Some people have actually lived like that without health issues, believing that once they are good, they eat healthy, they do exercises, and it works for them. But we've also seen cases where it doesn't really work like that. So how do you change the mindset of people to pay attention to treatments or taking care of themselves health-wise?
I'm going to give you an example to that. During this COVID-19 time, I had a friend who stays in London, and he's like, oh, I don't ever get sick, you know, just a few days before, like we talked, let's say yesterday, and he's like, oh, I never get sick, you know, I'm not even scared of this COVID-19 because, you know, for the past how many years, I haven't been to the hospital, you know, and all that. I was like, you not being sick doesn't mean that you're not supposed to get checked out. Now, guess what? A few days later, he spoke to me and he said, oh, I have COVID-19. Now, I wouldn't lie. It was kind of funny because I told him, I said, you have to take precautions, regardless of the fact that you believe so much. Religion is part of the reasons why people act this way, you know. So the fact that you believe so much in, you know, your religion that you're not gonna get sick or anything, that's not the reason why you're not supposed to, at least, even if you're not sick, go to the hospital, get properly tested, you know, try to know if your heart rate is going fine, you know, everything about you. Just, it's good to get that physical done, because that way, sometimes there's some sicknesses that you have that, you know, it takes a lot of time for it to show itself. And he told me he had COVID and he didn't have no symptoms. So he knew he had COVID because he had kids in the house.
Right. Thank you so much.
Understand? So
right.
If the kids weren't sick, then maybe you wouldn't get to find out that he had COVID. So that is like a big problem.
Thank you very much, Gloria.
You know, he was able to understand that you have to go and, you know, get tested, get checked out.
All right, Gloria, we have to wrap up now. Gloria.
Sorry?
We have to wrap up now. Unfortunately, we're out of time. But thank you so much. And we see the work you've done so far in ensuring young people get checked early and know their status in every circumstance. Thank you very much for joining us. We've been speaking with a medical practitioner and a youth counselor, Gloria Chibuike. It's been a good show. Good news to our live audience. You can join us through Zoom every Wednesday show, and you can log in with an ID that will be communicated to you, 44616066629. I know that's fast, but I think they would publicize that a bit later so that people who want to join in can join us via Zoom. We're still formalizing how that would work, but have a fabulous day. We'll see you tomorrow. Bye for now.
You can watch Your View on TVC every Monday to Friday, 9 a.m. to 10:30 a.m. Nigerian time on DSTV channel 418, GOTV channel 27 and channel 47, StarTimes channel 121 and channel 307, Play TV channel 801 and channel 190, UHF 49, Sky channel 515 for UK viewers. Watch live on Facebook at TVC Connect and on our website tvcentertainment.tv/livestream.